Asthma, it's a word so many of us know. For hundreds of millions, it's a part of daily life. But for a lot of people, it's still kind of a black box. So in this explainer, we're going to change that. We're going to pull back the curtain on everything from what's really going on inside your body to the absolute latest in treatments.
So here's our game plan. We're going to kick things off with the what. Like, what is physically happening in your lungs? Then, we'll get into the why, the different triggers that can cause an attack. After that, we'll switch gears to the practical stuff, how to manage it day to day, and some really cool advanced treatments. And we'll wrap it all up by talking about how to live well and really take control.
Okay, first, let's just get a sense of the scale we're talking about here. 300 million. That's a huge number, right? That's how many people around the globe are estimated to have asthma. To give you some perspective, that's like the entire population of the United States, all dealing with this same chronic condition.
So what does this actually look like inside your body? Take a look at these two images. On the left, that's a nice, open, healthy airway, plenty of room for air to move. But on the right, that's what happens during an asthma attack. You can see it's swollen, it's inflamed, it's getting squeezed shut. This picture right here, this is the heart of the matter.
All right, so we've seen that pretty dramatic before and after shot. Let's dig a little deeper and put a proper definition on what asthma really is.
Okay, so here's the deal. At its core, asthma is all about chronic inflammation. The best way to think about it is that the airways are they're super sensitive, almost twitchy. So when they come across something that irritates them, a trigger, they totally overreact. They swell up, they pump out a bunch of thick mucus, and the muscles wrapped around them clamp down. And all of that just squeezes the airway, making it tough, sometimes really tough, to get a good breath.
But what's causing that overreaction? What's the trigger? Well, this is where it gets really interesting. Because asthma isn't just one single thing. Nope. You can think of it as having two main flavors, and it all comes down to what's setting off that inflammation.
And this chart breaks it down for us perfectly. The big slice of the pie, about 60%, is allergic asthma. This is the one you hear about most often, especially with kids and younger adults. It's all about the immune system getting fired up in response to specific allergens.
So for someone with allergic asthma, their triggers are things out there in the world that their body mistakenly sees as an enemy. We're talking about the usual suspects, right? Pollen, those little dust mites in your carpet, pet dander from your dog or cat, even mold spores. And the cool thing is, allergy tests can actually pinpoint which of these is the culprit.
Then you've got the other 40%, which is non-allergic asthma. And just like the name says, the triggers here have nothing to do with allergies. Instead, the airways are reacting to other kinds of irritants. Things like getting sick with a cold, breathing in smoke, a blast of cold winter air, or even things like stress or a hard workout.
So you see, it doesn't matter if it's pollen or cold air, the end result is the same: inflamed, unhappy airways. So that leads us to the big practical question. What do you do about it? How do you take back control? Well, for most folks, the journey starts right here.
Yeah, I bet this looks pretty familiar to a lot of you. Inhalers are, without a doubt, the foundation of asthma treatment. They get the medicine right where it needs to go, straight to the lungs. But here's something that's absolutely critical to understand. Not all inhalers are the same. There are two main types, and you can't just swap them out for each other.
So let's break that down. A great way to think about it is offense versus defense. Over on the left, you've got your reliever or rescue inhaler. That's your offense. It's for when you're having symptoms right now. It works super fast to relax those tight muscles and open things up. Then, on the right, you've got your controller inhaler. That's your defense. You take this one every single day to keep that background inflammation down, to stop attacks before they even start.
And this is a really, really important point, so I want to be crystal clear. That rescue inhaler, it's amazing in an emergency. But, and this is a big but, if that's the only thing you're using, it's actually pretty dangerous. The global guidelines couldn't be clearer. Relying on it is like having a fire extinguisher to put out fires, but never fixing the faulty wiring that keeps starting them. You have to treat the root cause, that underlying inflammation, with a daily controller.
Okay, so what about the people who are doing everything right with their controllers, but it's still not enough? For those with really severe, stubborn asthma, there's a whole new wave of advanced treatments that are, frankly, game changers, and they offer so much hope.
First on the list are something called biological therapies, or biologics. Now, instead of thinking of a normal medication like a fire hose that just sprays everything, think of a biologic as a tiny laser-guided missile. It's designed to hunt down the exact little troublemakers in your immune system, specific cells or proteins that are causing all the inflammation. It's incredibly precise, stopping the problem right at the source.
Next up, specifically for people with severe allergic asthma, there's something called allergen immunotherapy, or AIT. You've probably heard of this as allergy shots, but you can also get it as tablets that dissolve under your tongue. The whole idea is pretty clever. You introduce tiny, gradually increasing amounts of whatever you're allergic to. The goal is to slowly teach your immune system to just chill out and stop overreacting to it.
And this is why AIT is such a massive deal. See, almost every other asthma treatment is about managing the symptoms, right? Keeping the inflammation down. But AIT is the only treatment we have that can actually change the course of the disease itself. It's not just putting a lid on things, it's retraining the system for a real long-term fix.
So these advanced treatments are amazing, no question. But they're not the complete picture. To really, truly live well with asthma, you have to look beyond the pharmacy. It's about creating a lifestyle that gives your lungs the best possible support.
And a lot of this stuff might sound basic, but don't underestimate how powerful it is. First off, avoiding tobacco smoke. That's an absolute must, non-negotiable. Staying active? Yep, regular exercise can actually make your lungs stronger and just make you feel better overall. Having a written action plan with your doctor is huge, so you're not guessing what to do when things get tricky. And hey, if your trigger is something at work, you got to figure out what it is and how to get away from it.
And all of this really leads to a final, pretty exciting thought. When you look at these super targeted biologic drugs and these therapies that can actually retrain the immune system, we're clearly moving into an age of personalized asthma care. And that begs a really cool question. Are we heading toward a future where we don't just manage asthma, but maybe we can stop it before it even starts? Makes you think, doesn't it?